Good morning, everybody, and welcome to our bi-weekly rendition of everything COVID in Wakefield. And I think it's probably appropriate that we're meeting today because 2 years ago today was when the CDC, I guess, announced its first COVID case in the United States. So it is I guess it's I don't know, it's the day of distinction and maybe a day of infamy in some of us, but we've been working hard for 2+ years on this, and I think that we're hopefully seeing a light at the end of the tunnel. So thank you again for everybody's hard work on this. Before we jump to the experts, I'm going to have our chair of the town council, Julie Smith Galvin, say a few words because she's got another meeting after this. Busy person, and we're very grateful for support and that she'll spend a few minutes with us today. So,
no, by no means am I doing work as important as everybody on this call. So thank you. Thank you all. I don't really have anything to add. I really want to hear what I can hear in the next 15 minutes. So I'm going to pass it right over to the experts.
Okay. Thank you. Thank you very much, Julie. Anthony, thank you for joining us again. But I see you more than I see my family members lately. That's a good thing, though. So Anthony, please, why don't you give us a couple of updates on what we're seeing, and then we'll go around our panel.
Sure, sounds good. Thank you, Steve. So I'm going to go briefly over the numbers that we're seeing in Wakefield right now in terms of COVID. Right now, we've seen kind of a sharp turn downwards, which is a good thing. We've been seeing average daily cases each week start to drop, and so Wakefield as a whole is following along, similarly to the national trend here. So we're starting to see where we might be getting over that peak with Omicron a little bit in terms of cases. One of the things that we had talked about actually recently on the town administrator's report, and as well now we're going to talk about a little bit, is that the data that we're collecting, we just want folks to understand that PCR testing, those results continue to be reported to the state automatically, and that's how we're getting a lot of our information. With the rise of antigen tests at home, as well as just antigen tests availability, a lot of our numbers are kind of an undercount of the number of cases that are truly out there. And so while we are following the data nationally, and we're looking at the models to see what we're expecting, we are looking at the data. We should be cautious in saying that we're over this, right? We're not completely out of the woods yet, because we want to make sure that people continue to do the things that keep them safe, the social distancing, the testing when you have symptoms, the isolation. We want to make sure that people prevent the spread as best as possible and continue to wear a mask. So this will only help our efforts moving forward. But currently we are at 22 average daily cases, and so if we continue to work at this, we will see that number drop.
And that was up around close to over 60, right? Just a short time.
Yes. Ago. So I believe a couple of weeks ago we were at about 73 average daily cases, and this is not out of line with other places in the area. I think it's just important to understand that as we come down, we got to keep working at it to make sure that the numbers stay down.
Great. Thank you.
Currently, the average total active cases right now is 650. So we've had a slight decrease in the active cases as well. But this is difficult to always calculate because we also have lots of folks testing positive with antigen tests. And so we continue to encourage, if there's any questions about isolation, there's been a couple changes with isolation timeline and quarantine timeline relatively recently. If there are questions, the health department is always ready to answer those questions, provide guidance on what best to do when there are symptoms or when you come in close contact with somebody. Please feel free to reach out to us and we can provide that information.
Great.
As we look at the vaccination numbers, each week we see a slight increase. We've been doing very well in most of the age groups. We're over 80 in a lot of them. The 20 to 29 age group that had been lagging behind before has increased slightly. It is now over 70%. But we want to stress that with the boosters availability, and this might be a good segue into our booster clinic that we're offering. We have a booster clinic coming to Wakefield on February 9th. That is from I believe 11 a.m. to actually let me check that time real quick. Does anybody, Jen, do you have the time for this clinic?
Hi, yep, it's 11 to 3, and it's going to be at the Hurd School on Cordis Street. So if you're new to town, you might not know the Hurd School. It's on Cordis Street, kind of near the lake, 27 Cordis Street. You can go to wakefield.ma.us/booster 2022 for the registration link and all the details. It's also on the main page of Wakefield, the Wakefield website.
Thank you. And so we're partnering with the state VaxBus on this effort. We want to make sure that we're making the vaccine as available to everybody as possible. We want to encourage that anybody 12 and older can get this vaccine, and the booster provides the greatest protection against our current variants as well as anything coming down the road. I'm going to let Doug talk about the public schools. We have been seeing the positivity rate hover somewhere around 20% still. And so again, this is similar data to the average daily cases. We're not capturing everybody right now. We want to make sure that everybody understands that we're still working towards this. We're still trying to capture as much data as possible, but the best we can do is we can capture that PCR data and continue to advocate for the safety measures.
Thank you.
And then the other piece I want to go over is just want to give a shout out to the contact tracers that have been working nonstop during this time. There's been a lot of changes recently, both at the state and the federal level, basically concerning contact tracing. And I think it's one of those tools that we will continue to use and we'll continue to deploy as needed, especially working in partnership with the schools. I think the contact tracing helps provide a lot of information to parents and families. So we'll be making sure to keep in contact with that.
Great, thank you. Doug, how's everything in the state of education?
Things are good in the schools. We're trending in the downward direction in regard to positive cases. This week we have 168 student cases and 30 faculty and staff cases. And so, we're down this week about 30% compared to where we were a week ago. And just as a reference to let people know where we are, before break on December 23rd, the total number of cases that we had in Wakefield to date, as of December 23rd, was 279 and 43. Since that time, since break, it's been about a month, we've had almost 700 student cases and almost 150 adult cases. So the trends that you're seeing in the state are also reflected at a much smaller scale in the school system. The good news is we're trending downward, as Anthony reported, which is really terrific news. So that's a very good thing. We're also kind of working with Anthony closely and our school nurses on a new opportunity that has come out from the state to really increase the footprint of our testing. And so it kind of shifts some things around, but the data that's been released from DESE really shows that test and stay has been an effective mitigation strategy, but may have kind of played its course. And really, if we can kind of reprioritize or refocus our efforts on testing symptomatic students in school and adults that opt into testing. You have to opt into testing, but if a family were to opt into testing and we kind of paid attention to students that have symptoms and adults that had symptoms, we would test vaccinated and unvaccinated in school, right? We would also pay attention to any outbreaks, any clusters, and we would still respond accordingly. If there was a cluster, we would coordinate with Anthony and the Department of Ed in the event that we needed to close a class or close a grade level or even a school. So that's the other part of the opportunity from DESE gives parents tests to provide for their children. So it will give one test per child per week. So in a way, it's kind of, it was described on our call yesterday as it's kind of like community contact or community pool testing, which really is brilliant because in other states and other countries have already ventured into this space very successfully. So I'm pleased to see we're looking at this. It has really nice potential. As Anthony has shared, the greatest mitigation strategies for us right now are masking, testing, and vaccinations. So, so that's kind of their 1, 1, and 1. So that's a very quick report from the schools. We will be testing faculty and staff on Sunday morning. I need to say thank you again to Tom Walsh for coordinating that testing. It's much appreciated. And that's it from the schools.
Thank you, Doug. Great segue to Tom Walsh, who was kind of motoring around there, I noticed. So I think he's stable now.
I had to find the right modem. I was a little unstable. But no, I just want to, everyone's already touched on mostly everything. The state numbers that came out, they had 14,384 positive cases yesterday. There are 86 fatalities, and they had a 15.3 positivity rate. So they are going down. But again, as Anthony has stated, a lot of people are doing the at-home testing, so they're not getting the PCRs. So those numbers are probably a little bit down from what they really are. But again, as what Doug said and what Anthony had said previous, get vaccinated, get boosted, wear your mask, when mandated or when you felt it's necessary to do so, you get into a crowd. But the town, because of Mr. Mayo, we've ordered additional tests to come into the community, and hopefully we'll be able to do a little bit more testing as we get these tests available. But everybody, I think the president's order also is that you can call up, and I think they get 6 or 8 of those tests per family. I'm not sure. I haven't done it yet, but I believe that's out there now.
Thank you. Yeah, great job. Laurel, then Elaine, anything to add from our extraordinary Board of Health members?
Thank you, Mr. Mayo. I just want to pivot a little bit, getting back to vaccination accessibility, because the Herd School Booster Clinic is an awesome opportunity, but it is smack in the middle of the school day. So, people have asked if we can do more local clinics. I will tell you, our model has been fabulous, but it is both labor and personnel intensive, and it's nice that we're using, able to use a herd school. So, so the Board of Health, and in conversations I've had with Anthony, we always just really do a needs assessment and what's going on. So continuing to use the Mass Vax search site really is the way to go. I mean, there are some, there are still some walk-ins that are a short drive away. Most pediatricians, people travel out of Wakefield to go to. If we were to look at our school records, lots of folks go to Woburn and Reading, which tells me that parents, have access for medical care outside our border. So please don't wait for us. We're doing as much as we can, but we're also trying to be wise with our resources. The contact tracing has really taken a bite, and the health department has other things such as inspectional services, and our Wake Up team is still really working. So as board members, we're really trying to be wise with resources. And the good news is we have plenty of vaccine in the community. Medford has been able to set up a weekly opportunity. I am looking at the pediatric data coming in. We're hearing that we should be getting announcements on the less than 5. And in that regard, we will really be partnering with the pediatricians in the world, because it's kind of funny. That's the age group who are used to getting vaccines, and they get lots of them. So again, we have fast moving changes, and we are all monitoring what can be done and utilizing all the resources. And again, mitigation. I mentioned the Swiss cheese model last summer, but masking and distancing and air and being outside and coping, and being kind to each other and being civil about mask wearing. We're not expecting people to engage in an argument. We're just putting down the message that masks do work. Cloth masks are now you know, the Omicron is so tiny that cloth masks are not the recommended way to go. They're something, but they're not quite. So what people are recommending is actually a surgical mask on first and the cloth mask over it if you want, in order to get a better fit, especially because the surgical mask, I usually have, hold on. Surgical masks often gap right here. So if you want to put your cloth cover over, that may add some protection. And of course, the N95s are coming more on the market, but do the best you can. It looks like we're going to get a reprieve, but always with a cautionary tale.
Great, thank you, Laurel. I think the other thing is that on the clinics, on the booster or vaccine clinics, we can't snap our fingers and get vaccines like that. So it does take us a while to get them. And Tom and Board of Health have done a great job, and our collaboration with our neighbors has really helped us to get as much vaccine as we can. And I think that as a community, we've done yeoman's work, and there's a lot of people that were vaccinated because of the support and the work by a lot of people there. So thank you. Elaine, I told you you'd never leave me. So
if you retire, do I get to go?
no, you have to stay. You're more important.
I'll speak on behalf of the nursing end and the traces. We presented last week, Melissa and I were on a call with our local Board of Health group that we have with nurses, and they were totally amazed at our last clinic that we held between Melrose and Wakefield and the amount of volunteers that we can get. They want to know how we did it. I told them to call you, Tom Walsh. And we were very, very proud. I was very, very proud to say how well this community has done. But a little shout out to the everyday person there who is answering us contact traces. We're working 7 days a week, even holidays, as people are amazed. They're helping us, gather that data. And to thank you, Jen, for your updates on the town website. I have referred so many people to that lately to tell them to keep a good eye on that. And to our local primary care physicians who seem all of a sudden in tracing, taking a big interest, making sure that their patients call them and tell them. So they're not only getting it from that stranger over the phone, they're saying to us, wow, I talked to my doctor. That's exactly the same thing they told us. Not all the time, because everything changes from hour to hour. And just when we call, sometimes it might be a little confusing when we have to kind of look everything up for every situation. But I think the community here has done a phenomenal job. And there's a lot of public health people out there that are very jealous of us.
Great. No, a really great team effort, and we've come a long way. And I'm going to be very cautious, but say it seems like we're, on the home stretch. I don't know if we've got a couple of turns to make, but I'm going to say we're on the home stretch. Not sprinting to the finish line yet, but maybe I know. Trying not to jinx it, but I think we're better than we were. To my favorite group, our 20 to 30-year-olds, you are doing better, but you are still lagging. So, please, really strongly consider the vaccinations. You've jumped up a lot. And maybe I'm speaking to a lot of my kids, my son's friends. Please, guys and gals, you're not invincible as much as think that you are. And I am anxiously awaiting the vaccines for those that are under 5. As a grandparent of one, I have a very keen interest there in making sure that they get safe too. And again, if the community has any questions, concerns, they can certainly contact my office, the Board of Health. We're certainly happy to work with you all and to help you through this. So really great job by everybody. Jen, did you have anything to add, or did we hit your stuff?
The only thing I just wanted to add was to follow up on Tom's comment about the tests. It's covidtestsplural.gov is the site you can go to order. And if that's not the avenue you want to choose, they also do have information on insurance reimbursement for testing on that site as well. And those links are on our COVID hub too, but it's covidtest.gov.
Perfect. And I will say that on the testing, on the rapid testing, if you're meeting with some family members and You know, if my 84-year-old parents can figure out how to use this when they're seeing some of their great grandchildren, I think you guys can too, out there. And very easy. You do the wrap, and then you feel a little bit better. Still socially distant, still wear a mask, still do all those things, but you give yourself a little bit of comfort. So thank you, everyone, for all of their efforts in this regard. Anybody have anything to say? Ed? Last point, Hurd School is on the corner of Pleasant and Cordis. And trivia fact, who went to there? Who attended Hurd School for 6 years? Oh, God knows.
It's the same student that played Rumpelstiltskin in the
Oh.
third grade play.
That would be me. Thank you. Perfect. All right, guys. Have a great day. Take care. Have a wonderful weekend. Bye.